Hey everyone, so it's been a minute and I want to give you an update on what I've been doing. We are in a therapy assessment today, and before we actually get started on the video, I wanted to share with you something that I mentioned later on in this video that I want to clarify now. Now, going off the angry black woman trope, I am definitely capable of anger and I'm definitely a black woman. However, in my experience, I have realized that it takes me so long to logically allow myself to get to anger that I can't really say I am quick to anger. I try to realize that I'm allowed to be angry, and it takes quite a bit out of me actually to get to that place. And honestly, by the time I am angry, it is a real logical decision to be angry, and it only increases once I realize the level of anger I should have had from the beginning. That being said, thank you for your time watching and enjoy my therapy session. Therapy assessment.
Nice to meet you. My name's Ashley. I'm a therapist with Monarch. Sorry for your wait. I know you've been waiting a little bit, but thanks for taking in there. How do you pronounce your first name? What is your date of birth?
June 26, 1993.
Okay.
They didn't explain it, but I figured it was just the assessment part of it, not a whole session. So
Right. Anybody else in the room with you there today or no?
I can't wait to say I have that too. So
But
the assessment so that I can be on track with everything else going on.
this is a rating skill that we do with everybody, okay?
Hopefully I don't go too far because I know I can go off track. So I'm going to try to focus on just answering the question.
So if you're feeling down, depressed, or hopeless,
Probably half the days, but mostly just depression. I did go to the doctor, so they said I was kind of high on that list. So working with dementia patients originally, and that kind of triggered, I think, the original bout of depression. So obviously, we're in a homeless situation right now. I was in one before I got that position, but I feel like it kind of triggered it going out of control, being at the dementia, than just being like feeling it. I haven't felt that bad since, so that's why I say that. I would say probably the last month and a half for sure. 4 years ago.
so for the past 4 years, on and off some.
Exactly.
Okay. Recent triggers for those feelings are homelessness, and anything else you want me to put for recent triggers?
The homeless part is like the least stressful. I think it's more just feeling out of control. And I have a daughter who I feel like is getting into a healthy space now with her emotions. She's only 2, but really was the trigger this time.
Gotcha. Little interest or pleasure in doing things. So this is saying you have not had interest in doing stuff.
No, I feel pretty good.
You've had interest? Okay. Trouble falling asleep, staying asleep, or sleeping too much?
So exhausted, I haven't noticed, but now that I'm kind of more rested, it is harder to fall asleep. I would say just several days.
Tired or having little energy?
Not every day.
And do you know when that kind of?
This last month specifically.
Poor appetite or overeating?
Poor appetite has initial stressors. I went a 2-week spout where I lost a lot of weight, and I looked at myself and like nothing fits. I realized I haven't had an appetite. Recently, this last month, I've actually had quite a large appetite.
Anyone is feeling bad about yourself, or feeling like you're a failure, or feeling like you let yourself or your family down?
Say several days.
Okay.
At the tail end, I was feeling it more in the last like 4 months, but this past month I feel a little bit more confident than I have been. So
next one is trouble with concentration or focus.
these several days, my memory I think is the main one. It's like I'm like, wait a minute, where am I? What have I been just doing?
Have you been moving or speaking more slowly than normal?
Yes.
Okay.
Half the days, maybe almost every day, but
be better off dead or of hurting yourself?
not at all.
How difficult have those things made it for you to take care of things that you need to do or to get along with others?
Somewhat difficult.
Okay.
Yeah.
Nervous, anxious, or on edge?
Nearly every day. Especially you said in the last month, right?
Last 2 weeks for
2
this
weeks.
one.
Okay, I'm sorry, half the days.
Not being able to stop or control your worries.
Much that I'm not feeling it, but just not being able to control it.
Not being able to control it.
Not at all.
Okay. Worrying too much about different things.
Say half the days for that one.
Relaxing.
Every day. This is like a conscious effort to relax.
Restless, that it's hard to sit still.
Say several days.
Becoming easily annoyed or irritable.
Not at all, I'd say.
Afraid as if something awful might happen.
Not at all.
How difficult have those things made it for you to take care of things that you need to do or to get along with others?
Let's say somewhat for that.
This is the risk of harm section that we do with everybody. Have you ever tried to kill yourself before?
No.
Do you have access to a gun?
No.
And have you had any thoughts of causing serious harm to other people?
No.
And you ever start to have those types of thoughts of hurting yourself or somebody else, and you start to think of a plan or how you're going to do it? Definitely reach out to one of your supports, call local crisis, call 911, or just go on to the nearest ER. All right, this is a trauma screen that we do with everybody. Ever experienced a natural disaster?
Earthquake, yeah.
Transportation accident?
I have, yeah.
A serious accident of some other kind while you were at work, home, or during a recreational activity?
Sorry, I wasn't in an accident, but I witnessed an accident.
You witnessed one? Okay,
Yeah.
something like that. An attack, hit, slapped, kicked, or beaten up before?
Yes.
And weapons have been shot at, stabbed, or threatened with a weapon?
No.
Sexual assault, made you perform a sexual act for some threat or harm?
Yes.
Or unwanted or uncomfortable sexual experience that does not quite fall within that sexual assault category?
Touching, yeah.
Mental or emotional abuse?
Yes.
A sudden violent death? So somebody that you know that was murdered or they committed suicide, either one?
Yes.
Have you ever caused serious injury, harm, or death to somebody else?
I consider it serious, but in middle school I tried to play a prank and ended up stabbing someone with a pencil, and they forgave me, but I was like, oh my god, I actually stabbed you with a pencil. It was one of those sit on a pin jokes.
Medical treatment or
Yeah.
anything for an accident, and you ended up causing serious harm.
Yeah,
Gotcha.
I could have. He was nice enough to not press charges on me.
Been forced to do something against your will and treated unfairly to benefit somebody else.
Yes.
You feel like you've experienced that was not covered by one of those other categories.
Yes.
And which one do you feel like has bothered you the most or caused you the most difficulty?
The combination of the assault and the verbal abuse.
Has trauma upset you, caused problems for you, or made problems worse?
Nearly every day.
You've dealt with depression for the past, you said 4 years on and off. Have you ever experienced an episode of mania before where your moods were more so elevated or not?
I feel like I've had high anxiety, and I've had people claim it was mania, but I've seen mania, and by comparison, in what I've described to my therapist my doctor at the time, they didn't categorize it as that.
So anxiety.
Yeah.
Have you dealt with anxiety for
Since I was a child, so.
a reason on your anxiety, or it's just lots of different things?
It's many things for sure. I'll just keep it at that, yeah.
With panic episodes or panic attacks?
I've only had 2 in my life. I know what they are. They don't have so much. I kind of check them.
Do you experience nightmares or bad dreams?
I have experienced nightmares more recently. It's ironic, like now that I'm not as in the space, I've had more dreams about it, yeah. This past summer, I feel like not so much like consciously am I thinking about it, but like my body reacts more to it, where I'm just like in the same emotional state physically.
Do you have trouble remembering certain parts of it or no?
Yes, that's my biggest, I think, insecurity is I'm just now remembering.
It's just now coming back. Do you feel like you have negative thoughts about yourself or the world due to what you went through?
About myself.
Blame yourself for it, even though it's not your fault?
Yes.
Or like you have a hard time forming close relationships with others?
Yes.
Okay. Do you feel like you're having a hard time experiencing positive emotions such as happiness, love, or joy?
Yes.
Is excessive irritability?
Now that I'm aware, like that happened, I feel like the snapping and like the anxiety that comes on really fast has gone down actually.
More alert, more aware of your surroundings, so extra aware of what's happening around you. So be it hallucinations or where you would hear or see things other people would not.
No. Excuse me.
So 4 years ago, you did medication and therapy. Okay.
Online therapy.
Okay.
And then the medication was for the depression, anxiety.
Your time with them helpful?
Yes.
Okay.
Prescribed the same antidepressant, anti-anxiety medicine. We're starting the therapy up again, so.
Anybody within your family with any mental health history that you know of or aware of?
On my mom's side, there's a lot of anxiety, and I think someone bipolarism.
With alcohol or drugs that you know of?
And my dad is definitely an alcoholic.
Any suicidal history?
I spoke on calling her hotline before, and
I just had the thoughts in the past. With alcohol or drugs for you at all, or no?
No, I've only done cannabis before, and I'm not doing it. So yes, I was doing it was like in college. So
Where did you grow up at, as far as what city or what state?
Seattle or around Seattle.
Who was within your household as you were growing up?
I have my older brother and my dad and stepmom. That was after the age of 7. Before 7, I was living with my mom, my sister, and my brother. She's younger. He has a different father. I don't talk to my dad. I don't talk to my brother. My sister and I talking again.
A relationship with anybody considered to be significant?
I consider myself to be single, but I am, not looking.
To the 2-year-old. Any other children?
No.
That's a daughter, you said?
Yes. She's been with me since she was born. She had some abuse at the age of about 4 months till a year, and about a year and a half. So I feel like we're definitely working through some of those issues, but overall, we're very close. And my biggest thing is that she shared with me what happened when she was able to. So that means a lot to me.
Getting out of an abusive relationship, there to be your supports or your go-to people?
Have an emergency, I can talk to my sister.
Enjoy doing, and it could be
Really able to indulge in it. I was working out, kind of just empowering myself by getting stronger.
sexual orientation.
I don't know.
You were a baby. Did you meet major milestones all time?
Like in 2nd grade, I had to go to a separate class to do reading.
Where had you been, like, before?
I had traveled quite a bit.
And how long have you been homeless for?
Out of my apartment since June, really on my own since September.
And is there a specific religion?
Christianity, but not like stringent.
Or health issues at all?
I have a lymphatic problem. I grew up when insurance wasn't legal. You had to have it, so I never went to the doctor as a kid, so like having a primary is like kind of foreign to me. I had one in Washington for like a little bit.
Nutrition, mental health affects hygiene, like being there, brushing teeth, stuff like that. How do you feel that that's been going for you lately?
I think it had to do with the eating as well, but I did have bleeding gums for a little bit. That was my biggest thing. I noticed that my nails and hairs started growing a lot slower.
And a lot of stress you've been under too, kind of thing. The ability to regulate or manage your emotions.
Really slow. Like processing things has been unusually slow for me. Logically and like emotionally regulating. It's just the regulation is harder because I'm having to process in a time frame that's like not in my control. You can tell me something, I'm like, tomorrow, I'll get it tomorrow, what you said, kind of a feeling.
Gotcha. Your communication skills.
I feel like I overcomplicate things sometimes. I think I overthink.
Self-esteem.
As honest as I can be to myself. That's my confidence in being like, I am a good person and I am these things because I don't like to lie to myself.
For education history.
Some college, I technically need to apply for my degree. I just haven't gotten through the process yet. I think I need to just commit to just starting over. And I've never really been this far, so.
Would you describe describe yourself in a positive way?
I can find humor as much as I try in every, even when I'm really sad, I'm like, well, there has to be something to laugh at, kind of.
Needs or goals? What's something you want to see happen for yourself?
Stable in a way that's not stressful, savings and doing all the things I'm supposed to do. But I didn't see myself fulfilled in other ways, and I think that's contributed to kind of getting back into the struggle of not being as stable, because I was relying on like people that weren't reliable to have emotional stability, or if I hadn't cared about those things, I would still be all right.
Abilities or skills?
Really enjoy helping people heal. Studying kinesiology or like sports medicine. Like I have a lot more information to understand myself now than I did then. That overthinking thing, I want to nip it in the bud. This sounds awful, but I had a gentleman that was in his like 60s, 70s, and he was really sweet, but I felt like he was really seeing me as like a grandchild more than like anything. So I felt like I was talking to my grandpa, which is hard because you want to have a good conversation and it's so pleasant, but
Somebody close to your age range?
I don't want to have everybody like the coddling thing. I don't want to be like, oh, I need someone to reassure me every day or every new thing that's going on. I want to be able to self-regulate that part.
You want to be able to do that yourself.
Exactly.
For diagnosis, I'm PTSD or depressive disorder at a moderate level curve with anxious distress